Welcome to animatedteeth.com and our page that outlines the steps of making a dental crown for a tooth. In this video, which is part 3 of our series that explains what the crowning procedure is like for the patient, we explain details related to taking the final impression of your tooth. The most common type of impression taken for crown fabrication is a physical one, meaning making a copy of your tooth using some type of impression paste or putty, and that's the process we describe in this video. With each passing year, it will become more and more likely that your dentist has the equipment to take a digital impression using an intraoral camera instead. This video's associated webpage provides further details about that technique if you're interested. The act of taking a tooth's impression is simple enough for the patient. The process is generally broken down into 2 phases. The first one is where your dentist gets your tooth ready. The second is the act of taking the impression itself. As a first step, your dentist must select an impression tray. That's because even when set, impression compounds are flexible and therefore a rigid tray is needed to support them so the copy of your tooth doesn't become distorted, like when pulling the impression from your mouth or when it's used by a dental laboratory to make your crown. A dentist will have several stock sizes of trays and will try 1 or 2 of them in your mouth to see how each fits. As they do, they will ask how things feel. A tray that is too large or small might hurt because it pinches your gums in an area where you're not numb. Or a tray that's too large might trigger your gag reflex. It's imperative that when your tooth's impression is taken you can hold relatively still and tolerate the tray in your mouth for several minutes. So when each tray is tried in, make sure your dentist knows if anything doesn't feel right. In preparing your tooth for its impression, foremost on your dentist's mind will be the gum tissue that surrounds your tooth. The edges of a dental crown usually lie at or below the gum line. So it's imperative that the impression materials can get into this region and accurately copy this portion of your tooth. A common obstacle is that the gums lie up against your tooth and therefore will tend to block the flow of impression material on past them. A solution is the placement of retraction cord. This is a yarn-like string that's tucked between the tooth and gums and then left in place for several minutes. The idea is that gums have memory in the sense that when the cord is taken out they will remain back away from the tooth long enough for the impression material to flow past them and around the tooth. Another potential gum tissue issue is bleeding. Most dental impression materials are hydrophobic, in this case meaning that the presence of water-containing solutions, like even just a drop of blood or saliva, can affect their accuracy. To help, many brands of retraction cords are impregnated with compounds that aid blood clotting. Or the cord might be dipped in a clot-promoting solution before being placed. In cases where bleeding is more persistent, your dentist may give you some additional injections in the gums around your tooth using an anesthetic that contains a vasoconstrictor. But since you're already numb, you shouldn't feel them. The process of placing the retraction cord is simple enough. Your dentist will use a hand tool to press the cord into the crevice between your tooth and gums. You'll feel pressure while they work, but, once again, since you're numb, it won't hurt. Once your dentist has managed your tooth's gum tissue issues, they'll be ready to take its impression. In quick succession, they'll first use tweezers and gently tease the retraction cord out, and then wash and dry your tooth. They'll then immediately begin to squirt the first layer of impression material around it. Just as soon as they've finished, they'll then squish the impression tray now filled with impression putty over your teeth. Once the tray has been positioned to their satisfaction, they'll hold it in place for several minutes as the impression materials set. Once set, the finished impression can then be pulled from your mouth. For your dentist, the impression-taking process, removing the retraction cord, washing and drying your tooth, and getting the impression materials placed, all before they have begun to set and before moisture tries to enter the work field, is a race against the clock. So, being as cooperative as possible will help them a lot. And really, all that means is sitting still and staying open. If you have an issue that needs attention, the time for managing it is after the cord has been placed and during the minutes while your dentist is waiting for it to do its work. Not after it's been removed and the impression-taking process has begun. FYI, the first impression material placed around your tooth will have a thin consistency. The idea is that the somewhat runny nature of this material allows it to flow into the narrow crevice between your tooth and gums. The material is dispensed from a device that's reminiscent of a caulking gun. The gun will be fitted with a tiny tip that allows the dentist to precisely inject impression material into the tight spaces that surround your tooth. Your dentist may also use their air syringe to gently blow and further direct the material into place. In comparison, impression paste or putty is substantially stiffer, and when the tray full of it is squished over your tooth, the pressure it creates further helps to force the flowable layer into the tiny confines around your tooth. With that, we'll wrap up this video. Hopefully you've gained some information that helps you understand what takes place when your tooth's final impression is taken for its crown. Goodbye.